I'm Professor Jane Farrar from Genetics in Trinity College Dublin, and I'd like to talk to you today a little bit about inherited retinal degenerations and the real importance and value of genetic testing for inherited retinal degenerations. There are many reasons that it's important. We now know there are about 260 different genes that are causative of different forms of inherited retinal degeneration. 20 years ago we thought there were 3 different genes, and that is not the full picture. There are even other disease genes we have not found yet. We haven't got a complete picture, but it's really important that we understand for any one patient what inherited disease they have. And why is that important for the patient? One, it tells us a little bit about how that disease is inherited for themselves and for family. And 2, it tells us a little bit as well about the severity of the disease. What's going to be the course of the disease? What's what we call the natural history of the disorder? And so we can understand more about the disease for patients as well. And importantly, because we now understand the cause of some genetic conditions, there are ways in which we can think about fixing them or developing therapies or gene-based medicines for them. There is a lot still to do, but excitingly, for some forms, there are gene-based medicines that have been in clinical trial and that are showing benefit. Indeed, the first of those has got to what we call the end of a phase 3 clinical trial and is moving towards the market. But I don't want to sound like it's all fixed and the solutions are all there. We're at the beginning of this. There are 260 different genes involved. Thus far, just a few diseases have been tested in clinical trial. So it's very important that patients get diagnosed and understand what form of the condition they have, what may be in the future the most relevant therapy for them. So we need to understand the basis of our disease for understanding the course of the disease, the clinical history, the inheritance of the disease, and also for seeing how relevant individual gene-based therapies will be in the future for those patients. It's really also important, I think, to understand in the whole area of research, we need to understand how each of those genes, which encodes a protein in the cell, that's the building block of the cell, we need to understand how each of those genes, when you have a mistake in it and your building block is not quite correct, how it causes some deficit in the retina. How does it cause a retinal disease? So we need to do much more fundamental basic research, and that will allow us then to actually develop even more novel, even more potent, effective therapies.